Hi, my name is Angelo Tenoyo. I'm a student nurse at Adventist University of the Philippines. Before we start, can I ask for your full name?
Bonifacio Rizal.
I'm Mr. Rizal. How are we doing today?
I'm doing great.
Great. So before we start, may I ask about your health history? Have you been hospitalized before for your nails, hair, or skin?
Yes, I had rashes.
Rashes? Great. Did you think that was from like your parents' genetic history?
My father has allergies.
Allergies? Okay. May I know what allergies that is?
Dust.
Dust. Okay. And I'm guessing, is that how your rashes start?
I think so.
You think so? Okay. Other questions I have for you. Have you had any skin cancer?
None.
None. Have you been tanning?
Somewhat.
Somewhat. And have you been using any sunscreen?
Not always.
Not always. Just to inform you, sunscreen does help in preventing skin cancer as it blocks the sun's UV rays. Right. So before we begin, I'm going to tell you what we're going to be doing today. So we're going to inspect for your skin, your hair, and your nails. And this is necessary so that we can know if you have any problems on those areas. And the fastest and the easiest ways we can do this is for you to cooperate with me so that you can be in and out of here and you'll be on your way. Alright, is that okay?
Okay.
Alright, and also the information that's shared here is going to be between you, me, and your healthcare team. Alright?
Okay.
Alright, so I have my supplies right here. You're going to wear your patient gown. I'm going to wash my hands and then we're going to start. Okay, is that right? Alright, cool. So now I wash my hands, I've done my gloves, and my patient has worn his patient gown. Alright, so Mr. Rizal, now we're going to do our skin inspection. So before we start, do I have your consent to touch you so that we can inspect your skin?
Sure.
Yeah, cool. So first thing we're doing, we're gonna do the inspection of the odor of the skin. I see the odor's fine. We're gonna go to the next procedure where we look at your skin variations and colorations. Right now, on the anterior forearm of my patient is a white pale, while the posterior forearm of my patient is a darker complex. It is the same thing here with my patient's legs. The thighs have a lighter complexion with the legs more of a darker complexion. I also see for the palms, my patient has a little bit of a red, but mostly a fair complexion. So overall, I think my patient has a tan coloration. So now we're done with the skin coloration variations. Now we're gonna look for any skin breakdowns. So I'm gonna look at my patient's ear. No redness from there. I'm gonna check for the elbow. Nothing over there. I'm gonna check for the knees right here. Nothing. And for the ankles, I don't see anything redness coming from those areas. Now, so this means I don't see any skin breakdowns from this. Now we're gonna look for any lesions on your skin. I see that on the forearms and the arms, there are no skin lesions. There is a mark right here that has a heart. That's probably okay. That's just a drawing. There is no lesions coming from the thighs to the legs. So I think that's all the information I have for that section. Now we're gonna go to the palpating of your skin texture. So first we're gonna do like both hands. We're gonna palpate, see the texture of the patient. I feel it's smooth. Look for the thickness. It's quite thick. Next, we're going to look at the patient's and just the patient's temperature and moisture. So I'm going to use my dorsal side of my hands to look for the temperature and the moisture. So I'm going to feel his arms. It's warm. I'm going to look at his undersides. Today, the bark is a little moisty. That's to be expected. Legs, again, warm, a little bit cold on the knees, but I think that's because we're in a conditioned room. So that's it. And then our next one is the mobility of the sternum. I'm gonna see if the skin's okay on there. So on the sternum, I'm going to pinch, mobility is fine. Release the tertiary spine of the sternum. And lastly, I'm going to look at the edema of my patient. So we're gonna get the legs up right here and palpate the ankles. I don't see any edema or any liquid coming out, so I think that's okay. So now that we're done with your skin, now we're gonna check for your hair for any problems. So for right now, I'm inspecting your hair. Your hair is black. It looks like it's well groomed. It's clean. And now we're gonna go to the next step. I'm going to see if we're looking for if it's well distributed, and it is. Now we're looking at the if the scalp has or the hair has any lesions or parasites or any scalping, and I don't see any, so I think your hair is okay. Now we're gonna do your nails. So first we're going to inspect my patient's nails. I'm gonna see its color. It's pink. Its texture. It's well groomed. It's clean. So I think we're good there. Now I'm gonna start to palpate the texture of your nail, or the shape of your nail first. Sorry. I see that your nail shape is 160 degrees from the bed to this, so I think that's fine. And then now we're going to palpate the nails, see if it's the texture of the nails, see if it's any smooth. So right now it's smooth but hard on the texture. If I pull the nail, it's firmly embedded to the nail bed. And now I'm going to palpate the nail to see if the capillaries refilled in 2 seconds, which that was just like 1 second. So I think that's okay. And now I think we're done with your assessment. So again, thank you for your time today, Mr. Rizal. I know it's been a hard and grueling task. Before anything else, I'm going to do a little bit of summary and then validate your problems. So I know for your skin, there wasn't any problems, nothing out of the ordinary from what I've seen. Your hair is the same, and then your nails are the same. Last but not least, are there any questions for me?
No.
No? Okay. And last but not least, so now I'm gonna take these findings. I'm gonna give it to your doctor, and he or she will give me any findings if there's any abnormalities. All right. So I'm gonna wash my hands. I'm gonna go. All right. Thank you so much for your cooperation. I hope you have a nice rest of the day. All right. Thank you.
God, slay.